Good afternoon, everyone, and welcome to what Saudi healthcare leaders need to know about the accreditation. International accreditation is very important. This topic for us is very important here in Saudi Arabia because few years ago, a major hospital in Saudi Arabia proudly expanded its facility and new building, advancing equipment, increasing bed capacity. From outside, it looks like it is a progress, but inside, something was missing. A patient was admitted for a routine procedure. The surgery itself will be successfully. However, a small breakdown may occur by the handover between the department. The medication reconciliations was incompleted. Documentation was unclear. Communication gap display and follow-up care might be in a problem. So nothing dramatically, nothing immediately alarm, but the patient stay longer than expected, cost increased, staff left frustrated, and that's why the leadership realized something important. By growing alone does not guarantee quality, and that's why at the moment the hospital leaders made strategy shift that the movement from asking how do we expand to ask how we standardize, measure, and sustain excellence. The collaboration between the American Association Accreditation and Nursing Solution Company have teamed up to improve the quality of healthcare in Saudi Arabia. Because, as you know, the accreditation for any health organization increase patient outcome, strengthen the healthcare system, and enhance institutional credibility. So the AAA has a famous renowned accreditation standards and knowledge where the Nation Solution Company offer a local knowledge, healthcare consultation, and workforce options. The collaboration will ease the process and expedite the time for accreditation for the institution here in Saudi Arabia that they are looking for the accreditation through the AAA. The rationale addressing the key gap, the vision for 2030 is changing Saudi Arabia healthcare systems by focusing on improving quality and getting the private sector involved. So the visions may, go and move beyond expanding services to ensure efficiency, safety, value, and patient-centered care. Also, the vision prioritizes different kinds of an area. For example, high value care instead of volume based care. It also prioritizes the outcome measurement rather than the service counts. It also focus on patient experience and satisfaction. And therefore, the healthcare success is now defined by the clinical outcome and safety indicator, not by the capacity as before. Even though all the hospitals here in Saudi Arabia must get a national accreditation, the Sipahi, only a small number have done so, and not many hospitals have international accreditation. So the outcome and vision for AAA and NSC provide the research conducted in Saudi Arabia have revealed that the international accreditation like GCI, Canadian, and Magnet have made clinical outcome and the culture of the patient safety better. In the same way, AAA accreditation facilitates are expected to have better performance measures such as patient satisfaction and also more public trust. Anwehi, which is one of the researcher that I read one study of for him, he did a systematic review and she found that the international accreditation has positive impact and improvement in patient care, safety, patient satisfaction, and better use of resources for the institutions, staff motivation, and good teamwork. The AAA accreditation help healthcare sectors its goal by giving a local institution more influence via ongoing improvement and by tracking scale local force in line with the Saudization innovation. Transformation for healthcare landscape. The healthcare system in Saudi Arabia is going through many changes and improvement right now. So in 2021, the Saudi government spent around 196 billion Saudi riyals, which is around 6% of GDP of the country on healthcare. And this number is still going up as the government raised to make service more accessible and better. The Vision 2030 introduced many changes that it will make it easier for the business sectors to get involved and for the big business partners to make healthcare better. The healthcare sector's transformation program main goals are to make more service available and turn public service into private ones by 2030. The partnership framework is ideal for establishing a AAA branded initiative that apply global experts to improve local healthcare. Saudi officials have actively sought international partners to accelerate progress. For instance, the Saudi officially contracted U.S. corporations like Cerner and GA Healthcare to enhance their health IT and manage infrastructures. The AAA and NSC cooperation is constantly with this trend of collaboration with an emphasis on quality standard and patient satisfaction as a critical aspect in making Saudi healthcare outstanding. The quality improvements as the healthcare system in the Kingdom of Saudi expanded its services, ensuring high quality care became increasingly important. To obtain a license, all hospitals must undergo national accreditation of Sibahi. So many elite hospitals also pursue voluntary international certification to demonstrate that they achieve world-class standards. However, it is difficult to implement and maintain this standard. The kingdom now has almost 499 hospitals, indicating that there is still room for increasing quality adaptation. And also, we saw also a great room for improvement in primary healthcare centers. So the study of Al-Qattan in 2024 showed that the number of primary healthcare centers are 2,120 from the data he collected from the Ministry of Health that published in 2020. There are also non-research data source showing about 1,008 medical centers across the country. So we can see here that the need of collaboration, the need of implementing the accreditation through the AAA with this huge number of hospitals, clinics, and it's very, very important. The value of international accreditation is well known. It gives an institution prestigious and has been demonstrated to draw in top-notch medical professions and improve the institutional public image. The hospitals in Saudi Arabia that are accredited have shown better results in a number of care measure, for example, fewer infection and better compliance and have a patient satisfaction. This makes it difficult evidence that there is a strong need to make certification available to more than just the few establishments that now have a AAA admission through NSC gives a hospital another avenue to get international quality accreditation in addition to the ones they already have. The healthcare accreditation market analysis in Saudi Arabia. The Vision 2030 is quickly changing the healthcare system in Saudi Arabia. This change put a lot of more focus on quality, patient safety, and accountability. And as a result, healthcare accreditation now key parts of a system reinforced instead of just a nice to have quality tools. The Saudi healthcare market is going because the population is growing also. People are living longer, more people are getting chronic diseases, and insurance coverage is getting better. Privatizations and public-private partnership have made competition stronger, which has forces healthcare providers to stand out by offering better quality and getting accredited. The market drivers for healthcare accreditation, the primary factor driven this trend are in increasing competition among private healthcare providers, the regulatory enforcement by the SIPAHI, the quality objectives of the Vision 2030, and the increasing expectations of insurance and patients for safety and for safe standards care. The accreditation industry has a lot of different service areas, such as training and education, accreditation counseling, digital quality management system, mock service, and compliance support service. A study from around the world suggests that accreditation institutions have better culture of patient safety, better documentation methods, better infection control, and strong governance structure. It is objective that the need for healthcare accreditation and related services in Saudi Arabia would continue to rise, and the accrediting system will keep moving forward because of the need for ongoing healthcare expansions, regulatory compliance, and worker training. The partnership between the AAA and NSC, rigorous programs for the hospital, clinic, labs, and training centers that follow ISQA approved global quality standards. The AAA accreditation show that the organization is committed to a high standard of patient safety, clinical care, and compliance, where the local healthcare insight by the Nursing Solution Company deeply understands of Saudi regulations, culture, and healthcare operations. So the NSC has a consultant on the ground that know the everything in healthcare system in Saudi Arabia and the problem it faces. The AAA name and stamp of approval are known all over the world, which boast an institutional reputation and make patients trusted more. Getting AAA accreditation can show that your facility is world class, which can bring in top doctor and even patients from other countries, especially we are focused in medical tourism nowadays. The NSC is the place to go for filling healthcare and learning and development across the country, and they are expert at establishing capacity that is hard to fill. Broader accreditation profile, in addition to the hospital, AAA certified personnel and accredited laboratories and training provider. This implies that the partners has the potential to provide a comprehensive quality ecosystem. The NSC company that is able to rapidly adapt solutions to the unique need of each client, regardless of whether they are large European hospitals or small private clinics. There is a team can frequently be presented on site, offering bilingual assistant, Arabic and English language for sure, and guarantee that the improvements are sustainable. In conclusion, the healthcare accreditation in Saudi Arabia has become an organized and growing market. It is very important for increasing the quality of healthcare, making sure patients are safe, and helping the goal of the Vision 2030 for changing the healthcare system in the country. Accreditation helps improve patient safety and the culture of the business by supporting leadership development, strategy planning, and staff participation. Our contact is here for the telephone, email, website, and address. We are here in Riyadh and Erga, and this is some of our partners that we worked with them in the previous 2 years. Here is the reference, and thank you very much.